Communication is the key to effective teamwork and the delivery of safe patient care. It is fundamental for decision-making, team coordination, and in maintaining situational awareness. Human factors science tells us that the inherent limitations of our memory, the effects of stress and fatigue, the risks associated with distractions and interruptions, and our limited ability to multitask ensure that even skilled, experienced providers will make mistakes. Effective communication methods create a well-understood plan of care, and this can greatly reduce the chances of error and consequently patient harm. Communication can be divided into 4 components. What? This is the information to be communicated.
The fact that we've been pushing now for 2 hours, there's no dissent.
How are you going to communicate?
Would you mind just grabbing a theatre pack with a consent form while I do that and coming back with it?
Why are you communicating this? Who are you communicating with? There are different types of communication that we use every day. Written communication. This form of communication needs to be clear, legible, precise and informative, as otherwise the information can be open to misinterpretation. Verbal communication and non-verbal communication. Our facial expressions, tone of voice, gestures and eye contact help us to convey emotion and reinforce our verbal communication. The best form of information transfer occurs during face-to-face conversations. This form of communication is especially important for expressing concerns and finding resolutions to conflict. Models of communication. Beth is a junior obstetric registrar in a tertiary hospital. She has reviewed a patient in the maternity assessment unit and diagnosed preeclampsia at 37 weeks gestation. The patient's blood pressure is 160/100. Beth documents her plan in the patient's notes for a CTG and for a stat dose of labetalol, which she prescribes. She then leaves to review an unwell patient on delivery suite. Beth is bleeped 1 hour later by the triage midwife. The patient's blood pressure is now 170/110. She asks whether the labetalol was given as prescribed. The triage midwife was not aware of the written plan made by Beth, as she had been called away to attend another patient, and therefore had not been able to read or confirm Beth's plan. Why might this have happened? Communication can be difficult due to both internal and external barriers. Internal barriers are those which affect us as individuals, such as language differences, our culture, our expectations of the situation, and our past experience. External barriers are those around us, such as background noise and distractions. In this scenario, Beth was using one-way communication. This form of communication is relatively quick, however there is no immediate feedback, and the receiver may not pay adequate attention to the instructions given. So, what could Beth have done differently in this scenario? By talking to the triage midwife, Beth can explain her assessment and plan for the patient, and this invites the midwife to ask any questions or clarify any information. Two-way communication involves both the receiver and the sender, forming a closed feedback loop. This form of communication allows for checking and correction of details, allowing both parties to work together to achieve a mutual understanding and prevent any misinterpretation of the original meaning of the information. Open questions should be used by both parties, using what or when questions, rather than those which invite yes or no answers, which are likely to lead to an automatic response and be potentially biased. Using open questions involves the recipient and means they must think about their response. Graded assertiveness. As any healthcare professional working within the NHS, we are exposed to increasing stress and workload. The intrinsic limitations of our memory, our environment, and the impact of stress and fatigue can all influence our communication with others. Safe and effective delivery of healthcare requires communication between individuals with different roles, training, experience, and perspectives on care. But within healthcare, hierarchy often prevents people from speaking up. The ability to speak up to express concerns is a key safety behaviour we should all have. Not speaking up, especially in junior team members, has been shown to be a contributing factor to many patient safety errors. Using the PACE tool could allow any healthcare professional to challenge any action or behaviour they may feel is inappropriate or unsafe. Let's look at an example. Sarah is a midwife and has called the neonatology doctor to attend a Category 2 caesarean section. The baby has been born, and the neonatologist is attempting to resuscitate the baby. The heart rate remains below 100 beats per minute, and the neonatologist is unable to inflate the lungs, with no chest rise visible. Sarah is helping the neonatologist by listening in to the baby's heartbeat and checking the oxygen saturations. Sarah is becoming increasingly concerned about the baby, as the neonatology doctor has become task-focused and believes that they are successfully resuscitating the baby. What would you do in this situation?
Is the chest rising? James, I really can't see the chest rising. James, the chest isn't rising. The heart rate isn't improving. Can I take over? James, this is not working. The chest isn't rising. The heart rate isn't improving. I'm putting out a 4-2 call. Please, can I take over?
By using the PACE tool to challenge the unsafe actions and behaviour of the doctor, Sarah has been able to stop the situation, allow for reassessment, and ensure the patient's safety. Handovers and SBAR. Working frequently in shifts results in dynamic teams, with members not being constant. Handover of care is therefore essential in developing a shared mental model and effective continuity of care. Poor communication at handover is a leading cause of patient harm. Handover should be multidisciplinary, formal, and follow a consistent format. You should have adequate time without distractions or interruptions. Have a clear leader. This should be the person who has maintained situational awareness throughout the previous shift and therefore has the knowledge to provide an accurate handover. The leader should highlight patients who are at risk or with concerns. Clear and unambiguous plans should be stated. At handover, exchange of sufficient and relevant information using standardised communication tools should be used. SBAR is a communication tool which allows healthcare professionals to communicate effectively and assertively with the right level of detail communicated in any clinical setting. SBAR can empower those who may feel less confident or less experienced than a senior to make a recommendation. SBAR is comprised into 4 prompts. Situation.
I'm Raquel, I'm the midwife looking after Lucy Brooks. She's a primary gravida 37+1, being induced for small for gestational age.
Background.
She has a BMI of 42, she had serious cancer in pregnancy and a small for gestational age baby is being diagnosed. She's being induced for that reason. The estimated fetal weight is 2.4 kilograms. She had an ARM at 6:30 at 3 centimeters dilated, started oxytocin at 6:45. Oxytocin is currently running at 8 mils per hour. She's contracting 2 in 10 and the CTG is...
Assessment.
My assessment is that we need to increase the oxytocin as per our current guidelines and she's not yet in established labour.
Recommendation.
Perform the vaginal examination in the next 4 hours after regular contractions, unless I've got early concerns.
Top tips on communicating in teams. Be explicit. Clearly state the desired action and who should do it, using both verbal and non-verbal communication. Use names to directly communicate to someone and ask them to report back to you when they have completed the action, closing the loop. Think of your timing. Do I need to communicate this now, or can it wait? Do not communicate if someone is task-focused, unless the information is urgent. Can you find someone else who can help you? Speak up and be assertive if you are concerned about another colleague's behaviour or decision-making. Be careful not to disregard the other person or come across as being aggressive. Asking questions to acquire more information may be all that is required to resolve a problem. Avoid interrupting, trying to work out what the person will say next, or changing the subject. Remember to actively listen to others, especially if they are trying to speak up. This is key in demonstrating effective communication skills.